Come in.
I'm washing my hands. Hi, Paul. I'm Nancy from Harper College. I'm a nurse. How are you?
Good. How are you?
I am good. I'm here to do an assessment of your neurological system.
Okay.
All right. I'm going to start by asking 2 questions. My first question is, have you ever had a stroke or a head injury in the past?
Nope.
Ever had any concussions where you were doing sports and you hit your head and got a concussion or
No.
lost consciousness?
No.
All right, good. All right, so first thing I'm going to do is check your strength in your extremities. So I'm going to start with your hands. Can you squeeze my fingers? Squeeze really hard. It won't hurt me. Good. You're nice and strong. Deeply. That's good. You can let go now. And then can you hold your hands up like this for a count of 10 seconds? 1, 2, 3, 4, 10. Wonderful. And then can you lift this leg up off for a count of 5 seconds? 1, 2, 3, 4, 5. Good. And then lift this one up. Count of 5 seconds. 1, 2, 3, 4, 5. Good. And then can you push like you're pressing on the pedal and pull back up towards your face? Wonderful. So your strength is intact and it's symmetrical. And I'm going to go a little out of order here because his feet are up, and I'm going to test your Babinski reflex. Sorry, I have to touch the bottom of your feet. Are you
Okay.
ticklish?
Nope.
All right, so I'm just going to go along the bottom of the foot and across the top. And he didn't have any response to that, which is normal, or curling of the toes for an adult would be normal or negative. So you go along the outside of the foot and across the top. Fantastic. All right, we can put the legs down there. You'll probably be more comfortable sitting up.
Yes.
All right. Good. All right, so from there we're going to do a test of some cerebellar functions. So can you do this as fast as you can? You can do it faster than I. All right, and then that's good. And then touch your nose and then touch my finger. No, with the same finger. That was pretty good, Paul. Okay, that's good. And then can you go like this with take your shin, your heel and run it down your shin, and then run it down the other shin.
Okay.
All right, that's good. And then can you come off of there? And then just head towards the wall, take a couple normal steps. And then come back and walk heel to toe, like this.
Okay.
Here, like this, heel to toe.
I see.
Yeah, like that. All right, that's good. So your balance is intact. And then come right over here. And then just stand up with your feet together and close your eyes. And then we would do this for a count of 20 seconds. I'm here just guarding, just in case he should lose his balance. He has his eyes closed, and he should be able to stand without losing his balance. And that's been 19, 20 seconds. Fantastic. You can come have a seat back up here. All right, good. So that was a test of your cerebellum for all your fine motor movements and your balance. And then we're going to do some tests of your sensory system. So can you close your eyes and just say now when you feel the wisp of cotton?
Now. 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 Now.
Okay, you can open your eyes. And then I want you to tell me whether you feel dull or sharp. This is dull, and then this will be sharp.
Okay.
All right, so close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull.
Okay, good. You can open your eyes. And then actually close your eyes again and hold your hand out. This is a test called stereognosis. Can you close your hand and tell me what that is?
It's a penny.
All right, fantastic. So that concludes the assessment of your sensory system. And then can you kind of scooch back a little bit and just relax your legs. And for the patellar or the quadricep reflex, just right below the kneecap. And you should see that, a little kick of the leg. Same on the other side. And then for the bicep reflex, this one's a little bit more difficult to do. It's very important that the patient is really relaxed. So if you can just put actually, first make a muscle for me. All right, relax. And then I find the tendon, And I put my thumb nice and firmly on that tendon, and then I use the pointy part of the reflex hammer, and I hit it right on my thumb. And his whole body jumped, but I was looking for his fingers to move, which I did not see. There we go. And then we do the same with this. So it's easiest if you start by having the person make a muscle like they're showing their guns, so you can find that where that tendon is, and you want to hold it firmly, and then you need to tap it firmly so that you see the fingers move there. There we go. All right. So that concludes the second part of the neurological assessment. We did the cranial nerves last time and mental status, and that was our cerebellar function and also strength and sensation and deep tendon reflexes. And that concludes the neurological assessment.